This is a great turnout, and I am so excited that so many of you are able to come. I know that you are busy, either already working or thinking about how it is you're going to start working again. And so taking this time, I know, is time out of your day. So thanks for doing it. Your work is so important. And as a community, we have really been working hard to try to find the resources that we've been hearing that you need. So we have had a community collaborative working on this, and we have several resources to share with you tonight that I'm really excited about. I do want to tell you that we are in the same boat as you, and we feel like at every turn we just have to pivot. So we're going to try to provide you the best information that we can for today, knowing that it will probably change in the future. We're going to have a couple different presenters tonight talk on different topics, such as this new guide that is out, as well as supplies. Like I said previously, feel free to chat throughout that time using the chat box down there. Please do keep yourself muted. With this many people, it would probably be a little chaotic. And then for the last 30 minutes, we will be breaking into two separate breakout groups. So one for Kansas and one for Missouri. And that's going to give you an opportunity to really ask state-specific questions. But this first information will be for everyone to hear. And then finally, I just want to add that we are recording this. We heard from several providers that they were not able to attend at this time tonight, and so we are recording it. So if you hear from others or you want someone else to see it, we will post it on our website afterwards. And so with that, I think we should get right to it. I'm going to turn it over to Giovanna Ross. I think. Giovanna?
Giovanna, you're on mute still.
Yes, I just saw that. I'm not used to having myself muted.
Thanks, Giovanna.
All right. Good evening. Thanks for joining us all. As Jenny said, we are really happy to have you here as we are learning together through the COVID-19 pandemic and trying to figure out what that means for child care providers of all types. Tonight, I am going to be sharing an overview of a guide that was just released officially, I would say Tuesday morning, late Monday night, early Tuesday morning, that was really born out of the necessity of trying to put together all the trusted information that was coming out from the Centers for Disease Control, from Caring for Our Children standards, from our state and local health departments in both Missouri and Kansas, from our state licensing departments, again in both Missouri and Kansas, as well as recommendations from the American Academy of Pediatrics. And really the intent of the guide is to help programs to think about their ability to reopen or to continue to provide services as more local and state governments are lifting their stay-at-home orders. We know it can be stressful as you're trying to make decisions about how to keep families and children safe during this unprecedented time. And the guide is really meant to provide a roadmap for programs as you really work to make critical decisions. It doesn't have all the answers to questions that you may have, but hopefully it'll point you in directions and get you thinking about things that maybe hadn't been thought about. Simple things that our group has been having, such as, how can I do sign in without having pens that I have to sanitize after each person comes in? Simple questions like that, up to the big questions of, how do I even decide that it's time for me to reopen again? I want to just share that the guide is all recommendations. There are no regulations that are in the guide. You know that you all offer or operate within your local licensing as well as your state health departments and local agencies. And so these are all recommendations and not regulations. However, the recommendations are there to help to really ensure continuity of services for children and families. A lot of the focus of the group that put this together was really thinking about what can we do to provide some guidance for programs so that they do not have exposure to COVID-19 within their settings so that they can stay open for the duration. And so that's where this group of recommendations comes from, as well as from all the trusted resources that I mentioned earlier. The guide is really just that. It's a guide. It's really things to ask yourself as you're thinking about operations, as you're thinking about writing policies and procedures for this new phase of opening and operating, and really thinking about, do I have what I need? And so the guide can help you to point you in the right direction to make sure you know local orders. We're in a very unique community here in our region in that even just crossing a few blocks puts you in a different county, which means that the local orders are different and the operating procedures in that area is different than where you just came from. We also want to make sure that it's clear how to get information about operating safely. We're going to talk just briefly about all the components that are available in the guide to illustrate what does that mean. And then the last piece is, do I have what we need to operate? And the least of which is not, do I have the staff? If I'm in a center, are my staff ready to come back and do they feel comfortable? Do I have enough staff to meet the needs of the families that are ready to come back as well? So it really is a place to stop and to think about, do I have what I need? And so the guide was sent out to you ahead of time, and I'm not going to go in order of the guide. I'm going to really highlight. And so I tried to put the page numbers of the guide where I'm referencing on the screen so that if you do have the guide in front of you, you are able to see that for you. The first thing that you have to do is, if you did close, you have to decide, am I ready to reopen? So our group came together and thought about what are the questions you would need to be able to answer to make that determination. And so the guide provides 10 questions, starting with, do I understand what the local guidance is and recommendations? What are the health policies? If you're down in, outside of Jackson County or Wyandotte County or Johnson County, it looks different than it does in those three counties. Then also, have I met with my staff virtually to understand their comfort with re-entering the program? Some of them haven't been out, let alone being in a program as well. And have I provided an opportunity for them to identify as vulnerable, as a member of the vulnerable population from the Centers for Disease Control? And then, based on my willingness and ability to staff the reentry of the program, do I have enough staff? So do I have the staff ready to go? You also want to keep in mind, what is the personal protective equipment I need to keep staff safe? And so we'll talk a little bit about what those items are and making sure that you have that available so staff and families feel safe as they're reentering the program. Do I have the supplies needed to conduct health screenings? So this, CDC has guidance about the health screenings. Do I have it there as well? Do I have supplies for increased cleaning and disinfecting of objects and surfaces? So our field is pretty unique, I think, in the sense that we do a lot of cleaning. We hand wash all the time. We're wiping down surfaces all the time. However, now everybody else is doing the same, and so access to those materials can sometimes be limited. And so you want to make sure that you have what you need in order to be able to clean and disinfect, what we call it, vigilantly during this time. The seventh question we put in there is, does the facility have enough physical space to implement social distancing? Making sure you have enough square feet, particularly as you're going to have some smaller group sizes. Really caring for our children, put out there having 42 to 54 square feet per person to be able to implement that social distancing. Again, a recommendation, not a regulation. And then if all of the above is in place, so if all those things are in place, do I have a written reentry plan that I can share with both my staff so that they feel comfortable, as well as families and others who are entering the facility? Do I know how I will train the staff and families on those new policies and procedures? And then the final question is, who do I contact to update my operating status? Many of you were asked to let your licensing representative know your operating status. And so you want to, if you are opening back up, you want to let them know. We have families that are going to be looking for care either from their current provider that they had before the shutdown, or maybe from a new provider because their provider is not available as they're looking. And so those are the 10 questions that the group outlined as you're making your decision to reopen. And I just want to say that communication is going to be key throughout all of this. And that's why you want to have as much communication, not only with the staff, but also with the families. Having those written policies and procedures of what you're implementing, as well as possibly a virtual town hall with families and then trainings with staff to let them know what to expect, to share with families how arrival and drop off might be different. And as we have been experiencing this, it's been a very iterative process. We start out going one way, and then we have maybe more information coming our way. It's going to be like that as we continue along as well, as we move through phase 1 and hopefully into phases 2 and 3. And so you're going to have to keep communicating with families about what's going to stay the same and what is different as well. And so there are several things that will be different when programs are reopening. The use of personal protective equipment, smaller group sizes, social distancing. And I see that in the question is social distancing being suggested? And it is recommended to think about how you can do social distancing and recognizing that it's difficult for young children and how we might have to change the environment for that. Vigilant cleaning and hand washing is really the name of the game. We're all in this and really keeping up with that so that we can help to stop and slow the spread of the virus. Also, setting up things such as a dedicated sick room may be different. Plating children's food instead of family-styled meals. Drop-off and pick-up procedures are going to be different. Having a health screening and temperature checks as families and children are coming in. Really rethinking the physical space that you have, as well as individualized bins and pencil boxes and supply boxes for children. And so those are the highlights that I am going to make as I'm looking through. But the one thing that I want to point out is that all these things are for now. They are not forever. I think when we see these things, sometimes it can feel like, oh my gosh, how are we going to do this? It's so against what I'm used to doing as an early childhood professional. And so just keep in mind, it's for now and not forever as we're looking at some of these. And so, like I said, the guide is pretty comprehensive. I see the links getting put up so that you can find those if you didn't see them before. And it really tries to cover various aspects, but we also want to hear from you as you're reading it through if there's things that are missing that would be helpful. So as we move into phase 2, we can be sure that we're adding that information in as well. So I wanted to start with personal protective equipment because this is the one that I think that we are hearing about quite a bit, about who needs what, when, how, and what should they be wearing. And so some of the personal protective equipment, or you'll hear PPE used quite a bit, are masks and face coverings. And that is the one that we tend to hear about. You mean the children need to be wearing masks? Well, yes, but it's one of those pieces. Cloth face covering should not be put on babies and children under the age of 2 or 2 and under, you hear in some places, because of the danger of suffocation. However, when feasible, your older children in your program should wear face masks. Feasible means that they can reliably wear that mask without constantly touching their face. So if we think about that, the purpose of the face mask is to keep you from getting things on others. But if they're always touching their face and the face mask is making their hands closer to their noses, their mouths, their eyes, you don't want them to be wearing that face mask. So you'll want to keep an eye on that. And so you really want to think about, can they reliably wear it without constantly touching their face? But adults should consider wearing those face masks and coverings. It's recommended that they be wearing those. It's also recommended that you have gloves available as well as smocks. So, I think we might be the only profession outside of the medical field area where we hear things about secretions and being able to change if we have secretions on us, particularly if you're working with infants and toddlers. Social distancing doesn't work with infants and toddlers. You're going to have them close, and they may, whether it's spit up or tears or mucus. So you'll want to think about what you can wear that you could take off to change. There's some recommendations about wearing shields and glasses during diaper changing as well that you'll find in the guide from the CDC. You want to be sure you're always using your most restrictive PPE when you're conducting those daily health checks, thinking about your gloves and your smocks and your face coverings with changing diapers, as well as when you're serving food and sanitizing toys as well. So that's kind of that brief overview of the PPE. I will tell you that the CDC has a great tool on there that has not only more information and videos about properly wearing face masks or masks and face coverings, but also how to properly don and doff is what they call it, but put on and take off your PPE. The order, kind of the order of operations, what should I put on first, after I wash my hands? And then how do I take my gloves off? Again, you all wear gloves when diapering. And so for some of you, it'll be second nature to do it in the way that they have outlined. The other change that you might have is having this sick room available, having a dedicated space. So if you do have someone that is sick, that they can be isolated, whether it's an adult while they're waiting for someone to pick them up, or whether it's a child. If you are going to be operating at your capacity less than what it was pre-COVID, you may have an empty classroom that you could use, or you might have an office space that's not being utilized, but having some of that in there or having a space would be great. You want to be sure that you require, and we try to do it anyway, but require that sick children and staff stay home. They shouldn't be in the program. And then monitor and plan for absenteeism of your staff. So it's an interesting time when it comes to care, not only for the children that you care for, but also the children of the employees and staff within your program. They may have childcare disruption. And so you want to be sure you monitor and plan for that absenteeism, whether it's through illness or because they are having some outside issues as well. So social distancing. So here's what I hear all the time. Giovanna, how am I going to social distance with infants and toddlers? My response is you're not. That's the group that it's going to be really difficult to not only keep them from hugging you or them needing to be comforted, but you're going to want to try to set things up while you're in the classroom so that you can try to keep them in smaller groups. You want to, with your older children, really try to think about your space so that you can give them more opportunity to have some individual time as well as that smaller groups. You definitely want to avoid mass gatherings. So, gone are the days for a little bit, remember for now, not forever, of more than one classroom being out on the playground at any one time. You want to be sure that you create smaller and stable groups. And so what does that mean? That's a group that varies. In our guide for groups for children age 3 and older, we suggest 10 children with 2 adults to help to really eliminate the need for floaters. You don't want to have a floater that is going to more than one room. When you think about this social distancing, you want to think about it lessening the ability for cross-contamination. If I have a floater like I've had in the past in a school, in a program, and if they go to more than one classroom, then they're taking with them from each classroom to classroom, what they may have encountered. And so you want to keep those stable groups, which means the same group of children and adults within that classroom, and they're going to stay in that room. We're not going to be switching rooms. We're not going to be using shared spaces besides the outdoors as well. If possible, you want to stagger arrival times and really consider how to limit physical contact with families. And we'll talk about that a little bit more, and it's outlined in the guide as well. You want to reconfigure your nap time placement of cots. They recommend, of course, the 6 feet, but knowing room spaces, you might not be able to do that. So at least putting children head to toe so that way their heads are distanced from each other. You want to reconfigure the physical space and the materials that you have, again, so it allows for the smaller group opportunities, and really think about how to be creative with those no contact games on the playground. The guide has a link to a site that provides a variety of things you can do on the playground, such as shadow tag rather than tag as well. And so group sizes for children 3 and older will be smaller during early phases of reopening. And like I said earlier, this will vary county to county. Stable groups, when you're making staffing plans, be sure you think about how to keep those group size stable and really work to avoid mixing groups of children and staff. We tend to have the collapsing of classrooms or combining of classrooms at the beginning and end of the day. If you're keeping a stable group, it's going to be really difficult to do that. So you may have to reconfigure your staffing patterns. The other thing is that we tend to not be in insulated insulated programs. We have other supports that might be coming in. Maybe it's a therapist from First Steps or from Infant Toddler Services, or maybe somebody comes to work with the children in 3 to 5, or volunteers come in. And our recommendation is that while parents are not being allowed into the program and delivering their child to the classrooms, outside support should not be in the building either. Continue to do those distance interactions as well. However, of course, you want to be sure that licensing and other state and local monitoring personnel are permitted in the building following the screening procedure that you have set up within your policies. So this is the key piece, I think, within all of the work that we're doing, and is not something that is too foreign to the world of early childhood education and care. But we really want to intensify efforts. We want to be sure that we are removing items that can't be easily cleaned and disinfected, and we all know what those things are in our rooms that are sometimes that pain point when you're trying to do some disinfection. You want to be sure you have a place where you can put items that are mouthed and soiled until they can be clean and disinfected. I've heard them called a yuck bucket. So you just kind of be able to throw it in there until you're able to clean and disinfect. You don't want to share toys with other groups before they've been washed and disinfected. So thinking about, you have smaller groups, somebody says, hey, can I borrow your markers that you have? Well, if they haven't been cleaned and disinfected, you don't want them to move. Or if they want to borrow your cubes that you have. If you have machine washable cloth toys, they should be used by only one child at a time or not at all. So let's think about that. That tends to mean like dress up clothes. So if you're okay with them using one and then putting it into a laundry basket to be washed, that's fine, but it's not going to be an opportunity time right now for children to get undressed and then the next child to put that on. But we do know that children's books and other paper-based materials are not considered a high risk for transmission. And then we just call out the difference between cleaning and disinfecting. And so knowing that getting that visible dirt and taking that off first, and then really focusing on that, killing the germs, is what you want to be able to do within your programs. Vigilant hand hygiene. I think our field is way ahead in this. We wash our hands all the time, right? You wash your hands when you get there, when you're before diapering, after diapering, before eating, after going outside. And so place posters everywhere for reminders. There's all kinds of posters that are out there. You guys can make your own as well. And just that reminder, wash with soap and water for at least 20 seconds. that's the great time to implement all those songs. There's a lot of great songs, again, that are out there and available for use. I think now that adults outside of our field have started to think about washing for 20 seconds, we're getting much more creative information out there. You can use hand sanitizers as long as your hands are not visibly dirty. And for young children, there is guidance out there, and you want to just be sure you have adult supervision. Soap and water is always best, but you can use the hand sanitizers when necessary. So drop off and pick up is another piece that we highlight within the guide. And this is the one that I think is going to be the biggest change as far as routines for programs, because we are so used to, as early childhood educators, to have the families come into the room to have a conversation, to settle the children in. And now we're going to be getting to a point where we want to really minimize the number of people that are coming into our programs. And so we want to think about, how could you stagger? You know, could you have different adults come in with their children at different times? Think about having the same consistent adult bringing their child to the program, because you want to limit that physical contact. And so while that picture on the right-hand side is somewhat humorous, it's kind of almost what it's going to be. Some programs are implementing curbside pickup, where a family calls when they arrive. Some are having them come into, if they have a vestibule or an entryway. Some are just making the 6-foot marks out on the sidewalks for families as well. You want to be sure you have hand hygiene stations readily available. So if you don't have a sink right at your entrance, you want to be sure you have the hand sanitizer ready as well. And if possible, you want to try to do it outside or from the entryway, and think creatively about how to not have to have a lot of pens. Some of you are doing electronic sign in, and so maybe there's a way that, I know in the state of Missouri, you can scan a QR code in some programs where they can get signed in as well. For the drop off and pickup, we actually have a sample policy and procedure around that that is linked to in the guide, that you can get and then save it, and you can modify it for your program as well. Another piece that's going to be a change during this initial phase is this arrival screening procedure. The CDC gave 3 different examples of how to screen children and family members upon arrival. They talk about being able to take the temperature of the children, and we're looking for 100 degrees as sort of the cutoff there. And you're going to also be looking for other signs of illness. You might have a checklist that asks the questions about, have you had a fever in the last 24 hours? Have you had a dry cough? Have you had difficulty breathing? You're going to exclude children who have fever or other signs of illness. Children who are sick for typical reasons should be excluded according to your policies. I think that's the hardest part about this for working with young children, is that sometimes our teething infants may have a fever because of that. But right now, it's really hard to know what that is. The recommendation that has been put forth is that individuals should be fever-free for at least 72 hours without the use of fever reducers before returning. And again, this is a for now recommendation, not a forever recommendation. And so the other piece is really around just making sure that you also are thinking about the members of the family with whom the children dwell. The children and the family member that brings them off may not be vulnerable, a member of the vulnerable population, but they may dwell with others who are. And so you want to be sure that we're keeping everyone safe and putting in clear and communicated exclusion criteria. And that's the key around this, is really communicating what the procedure is and what the expectation for exclusion is and the expectation for returning. The guide outlines if somebody has been diagnosed with COVID-19 in your program, what steps to take, as well as the timing of when someone can come back as well. All right, so food preparation and meal service. You know, one of the joys when I was in the classroom was our family style meals. That again is something that needs to be put on pause. In order to limit the number of hands that are touching serving utensils, it is recommended that meals be served in classrooms and one adult should plate each child's meal. And also it's recommended that during the early phases, consider the use of disposable dishes and utensils, just to ensure that things aren't missed in the cleaning process as well. Again, recommendation there, but really that plating of each child's meal is something we would strongly recommend consideration. So since you're going to be having fewer children in the classroom, possibly because of the reduced group size, and because you want to try to enhance the possibility that social distancing would happen with your older children, when you're setting up the physical space, you want to declutter and spread out the furniture. So it makes it easier to not only social distance, but to clean and disinfect. One of the things you want to consider removing is the sensory table. That just in and of itself, it kind of explains why you would want to move it, because of the difficulty to clean those pieces between uses. You want to be sure that the toys and items you leave out in your decluttering are easy to clean and disinfect. And really think about when you're setting up your circle time, you can still have it, but making sure that children are not knee to knee, that they have that space between them. And then also think about how you have centers that and maybe provocation stations that allow for that individual play within the classroom as well. And then the last piece that might be different as well is that individual supply and storage box. You know, a lot of us have maybe displays with the crayons, the markers, all the things that we might use regularly. And during this time, it's really going back to individual supply boxes that you can really make sure that one child is really accessing. It's really difficult, if not impossible, to disinfect crayons as well. And you want to keep each child's bedding separate using labeled bins. You can put them in cubbies or bags. You just want to make sure that they aren't touching after as well. So just overall tips. I mean, that's a lot of information, and the guide has all that information in there. Is just communicate, 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 you know, internally and externally. Make sure people know what it is you're doing to help to build the trust that you're doing all you can to keep everyone safe. Really consider how you can revise your pickup and drop off routines. It's going to feel different because you are no longer going to be inviting families into your classrooms, but you are still going to have that social interaction at the pickup and drop off time. You'll want to institute wellness checks upon arrival and make sure that you're clearly communicating, again, your exclusion criteria. And I don't think anybody can say it enough, but clean, clean, and clean again. And so making sure that you are wiping down and disinfecting those surfaces that are touched frequently, those doorknobs, the light switches, etc. And then think about how you can adjust your routines, the types of activities that you're offering, the meal times, the nap times, the staffing patterns. And, you know, we aren't able to think about everything that you may encounter. We really rely on you all to help us to fill in gaps that we may have missed in this first phase, because each piece is going to be each phase is going to bring a different nuance to it. And so we are going to be continuing to think about this together. And it's really from those of you that are out implementing the work that helps to inform some of the guidance that we can provide. And so I appreciate the opportunity to share the plan that is available. I think the link has been put up in the website. It's in a variety of places. It's been in the chat box as well. And I'm sure there'll be a way for us to send it out again to those who registered. And then on the right-hand side of your screen are all the agencies that contributed to this plan. And so if you have specific questions to your program, your licensing rep is going to be your best place to start. And then there are other resources within the guide that you can look into as well. So I appreciate your time this evening and joining in this discussion, and you'll have some time in your chat groups or your peer support groups as well to talk about some of the components.
Thank you, Giovanna. I've kind of been watching the chat here a little bit. A few of you did not have access to the guide, and we have shared that in the chat. If you want to pull it up, that you should have the link there. If not, again, like Carol said, that is going to be on our website. If it's not already there, it may be.
Jenny, it is on the Family Conservancy website.
It's already there?
Yes, under the COVID.
Perfect, thank you. Under the COVID tab on our website, there's a drop down and you can click on resources for providers or for families. So go to the one that says for providers. Do we want to answer individual questions in the state breakout groups, Giovanna? Is that how you?
I didn't see, I saw a few questions around the HIPAA pieces. Those might be good to ask within our state as well. And then you're seeing the different temperatures, 100 degrees in Missouri, 100.4 in Kansas. It was asked if masks are required or recommended. Again, they're recommended, particularly for children 3 and over, as long as they aren't touching their face more because they have them on as well. And I think some of the questions just about individual policies might be best in our except I see one from Trina that asks about for playground use. And like Trina says, and there she says, is it necessary to clean between groups? She's heard it's a waste of time and supplies. We've heard both ways. The recommendation in that the latest recommendation that we had one of our programs implement was to have a cleaning between, particularly on the playground surfaces. I think the most effective approach is to try to change up what you're doing on the playgrounds and changing what you're taking out with you onto the playgrounds as well. But the biggest thing is to keep stable groups while you're on the playground and not having more than one class group of children out at a time. We will continue to monitor sort of the guide to disinfecting on the playgrounds as well.
But Giovanna, I can't thank you enough for sharing this tonight. This is an incredibly comprehensive guide, and I'm very hopeful that providers will be able to have some pieces to pick out of it that will work for them. And if you do have more individual questions, obviously there are differences between states and between counties, and please know that we're going to have some people in the small chats from licensing tonight that can help you think about that. But as well, we've got coaches at the Family Conservancy that are very happy to help you think through those situations that you might need help with. The playground conversation, though, makes me, it's our natural transition into supplies. Giovanna, can you change that slide? There we go. So we've got Sarah Shirk with us tonight. We have had some big efforts around supplies in our community. And Sarah, I'm going to turn it over to her to lead that conversation.
Thanks, Jenny. And that was such great information, and I appreciate everyone being here and all the hard work that Giovanna and the team has done, as well as Jenny and the Early Learning Education Community Collaborative overall. So thank you for everything. So I'm just going to start by kind of giving a brief overview of kind of our partnerships that we have in place to get provider supplies, but kind of even a little bit further than that on what we're doing as a region and how childcare providers work into that whole vision that we have. So we have what we call a MAC S or a MAC G, two different ones, but really it's what we call an incident command structure or ICS. And so we have a lead, and then it kind of trickles down from there on all of the work that we do for the region, anywhere from child care providers to long-term care facilities to public health, hospitals, emergency managers. And from that, we also have different ESFs, so emergency support functions. The two that are really relevant for this group and the work that I do, and then Sean does as well, is the emergency support function 6, which is mass care and human services, and then ESF 8, which is health and medical. So that EFS 6 is really focusing on getting supplies and getting assistance for those individuals in our community. So that mass care and human services sides of things. And while there's a lot of activities going on through that, one of those big pieces that really relates for child care providers is donations management. And part of that came from that donations management group, and part of it came from our early learning education community collaborative. And so we kind of fit those two pieces together. As donations management was ramping up, we were trying to meet child care provider needs while that was going on, which is why we were sending out the surveys and trying to meet people's needs that we could at the time. But with the donations management happening, hopefully we'll be able to facilitate a little bit more of that even. And I'll let Sean go into more of those details. But, and a lot of this started with our Community Disaster Resiliency Network, CDRN, and from that, the subgroup of the Children and Youth in Disasters group. And I support that work through MARC Emergency Services. So I would like to talk about the PPE cooperative purchasing efforts, and then let Sean go forward with the regional donations management. For the PPE cooperative purchasing, we did have a meeting last week on May 6th, and we had some child care providers and licensing, as well as the Family Conservancy and MARC individuals there, and really talked with our financial department on how does that cooperative purchasing work for child care providers. And we really wanted to understand that criteria. So it is that you have to be a 501c3 or a government agency to actually partake in the cooperative purchasing through MARC. However, we did brainstorm some other ways for those providers who may be family providers or aren't 501c3s. And so those are some conversations that we might want to have, but really what it is MARC does this purchasing on behalf of organizations within our community, because many organizations can't meet the threshold of cost or amount to actually purchase through a vendor. And that definitely goes forward for child care providers, right? So if you're interested in that in any capacity and you want to think about that, even if you do have a private or business, please get in touch with myself or Jenny or Carol Layers, and we'll help with that as well. And I may have missed some things, but Sean, I'm going to turn it over to you for regional donations management, if you're okay with that. And yeah, thanks.
Thank you, Sarah. This is Sean Hurley with MARC Emergency Services, and my role over at the MARC is to be an emergency services planner and also the exercise coordinator. I'm currently serving under Emergency Support Function 6 as the Donations Management Unit Leader. And I know this might be some new information for you all, and there's a lot of information to consume, but I will just kind of hit the key talking points on where we began and where we're currently at in this whole process for COVID-19. So we currently sent a request originally to AmeriCorps St. Louis, and they currently have 5 individuals here in the region located at the Independence Emergency Operations Center. And we also have the Adventists on standby to help with warehouse staffing as needed. So what we currently have going on right now is we teamed up with United Way 211 and our emergency service providers here in the region. And 211 has established a donations hotline on our behalf to basically accept personal protective equipment, cleaning supplies, baby items, and other sanitary supplies that we really see a need for based on some of the surveys that Sarah had mentioned in her brief. So this 211 number is for any individual, organization, or corporation that's interested in donating items. They simply, all they have to do is call 211 and then press #2 for donations information. And they'll be rerouted to a AmeriCorps operator who will give them some basic information on depending on where they're at, different drop-off locations and hour of operations. So the hotline is currently open from 9 a.m. to 6 p.m. Monday through Friday, and then also 10 a.m. to 4 p.m. on Saturday. So like I had mentioned, that information is being staffed by AmeriCorps St. Louis. We have posted that information on Prepare Metro KC, and also Mark yesterday put that information on their Facebook page. So I would encourage everybody to go to Mark's Facebook page and look into yesterday's postings to find the donations management information and share that. And hopefully that will help increase some of the volume and donations that we see. We are working with our regional PIOs to also get that posted out on social media to get the word out there that we are accepting donations. And so we're going to continue to do that and, work through different various channels such as Chambers of Commerce, Visit KC, Hotel and Lodging Association of Greater Kansas City. But the more we can share that information and post that out, especially now because we are, a lot of us are already in phase 1 and people are slowly being able to get out, they can go and purchase items and bring them to those donation sites, either at the jurisdictional level or at one of our regional warehouses. So with that being said, we do have 2 regional warehouses. One is the Heart to Heart International warehouse in Lenexa, Kansas, which will accept bulk supplies. And then we have the Sermon Community Center, also in Independence, that's being utilized as a regional warehouse. So there are currently some drop-off locations in local jurisdictions such as Independence, Lee Summit, Shawnee, Overland Park, and Central Jackson County. So some of those, what we would do is when somebody calls the donations line, they would direct people to the Sermon Center or Lee Summit Fire Department headquarters, which are currently open to the public and have different hours of operation, whereas Shawnee Fire Station 71, they would need to schedule an appointment with Tracy DeVader in order to drop items off. So there's a lot of moving parts to this. As far as the MAC system, the multi-agency coordination system, we're here to simply support our local jurisdictions and our CDRN providers. So this is an additional avenue to request resources. With that being said, we did release the Regional Donations Management Guide. That's basically a really simplistic 2-page document, and then on the 3rd page, a list of items that are being accepted through the donations management call center. And so basically what that guide really is just a simple reference for how you request and receive donations. So this guide was developed for emergency managers, jurisdictional leads in charge of donations within their jurisdiction, and also you, the child care providers. We did have to update one of the numbers in that guide. We did that this evening, and we'll get that new information out to you. We saw that a correction was needed. Email is still the same in that guide. But in the future, we might see some possible changes as donations start to increase. We want to make sure that we're flexible. So this might include a resource request form that you could fill out online, and that information would be shared with you. As that information comes in on what you need, we will simply see if we're at the capacity in order to meet your need and fill that resource requisition to get you the things that you need. One of the things is, I guess one of the topics that has been discussed quite a bit recently is transportation and delivery of items. When we originally set this up, our primary deliveries were for the jurisdictional warehouses, and that's still the case for the time being. And those will be on Mondays. And the reason we did that, there were a couple of reasons. One, when we receive items, we make sure that they're disinfected and then they're sterilized, and they're not constantly changing hands. So we want to make sure that whatever we get in as a donation comes in, it's sterilized, and it gets from point A to point B without, with as little as hand-to-hand contact as possible, given the current situation. Another issue is manpower and logistics. But I was recently informed that there is some concern for our partners on the Kansas side that distance could be a potential issue with having to go all the way over to the Sermon Center. So we are opening up that dialogue to you all. If you have a place in mind that items could be dropped off a location at on Mondays, we would be more than happy to work with child care providers to do that, and working with a main point of contact so we kind of have some span of control and make sure we have some consistency in our logistics. So the MAX section, ESF 6, is open to working with you guys and fulfilling your needs. But we have to be cognizant that this is a really different type of incident or disaster, if you will, as far as donations go, because when you have an incident like the Joplin, Missouri tornado, it's in an isolated geographical location, and a lot of donations usually go pouring into those places, whereas the current situation we're facing is a lot of people have the same needs nationwide and actually globally. So it's harder to get your hands on some of those items. I know that the stores have done a pretty good job to make sure that people aren't stockpiling certain materials. So that also kind of becomes a concern as far as donations, because people might want to go out and buy a lot of things from Walmart or Target, but they're only allowed so many items. So this is kind of uncharted waters, but we're going to do our best to help you all out. And if you have any questions, you can reach out to Sarah and I. And if you have any questions right now, I'd be more than happy to answer those questions.
So Sean or Sarah, either one, you alluded to the survey earlier, which we do have available on our website, but for my own sake, as well as the providers, just to seek clarity, do you still want providers to fill out that survey, or do you want them to contact donations management directly? And if so, how do they do that?
Sean, do you want to take that one?
Well, when you say survey, I'm sorry, for clarification, I know there were surveys that went out on needs, and you'll have to excuse my background in emergency management. If somebody is requesting a resource, we call it a resource requisition. So is that kind of the same thing you're talking about when you say somebody filled out a survey and it says we need X amount of items?
Yes, so Sarah sent out a survey on both sides of the state line through our different partners to ask what kinds of supplies they needed, and if so, how many?
Yeah, sure. So we're reviewing those right now, and what we can do is we can reach out. AmeriCorps members can reach out and let you know if we have those items or if not. and, you know, just being flexible that sometimes the needs change and there might be additional items that you need, so that resource form or that new survey may go out again, just to kind of see where we're currently at and see if resources are being met or if there's still gaps out there. So yeah, they can go the survey route if you want further clarification, or you want information, you want to talk to somebody, they can reach out to that phone number that's listed in the resource guide. We're changing it, so we'll get that out to you. But you can also reach out to Sarah or any member of the AmeriCorps staff if you have any questions.
So filling out a survey or calling directly, either of those options will work.
Yes.
Okay, thank you.
Yeah, and Jenny, I will say we had several conversations about that survey and the resource guide. We still want to keep a specific survey just for our child care providers as a particular group that we want to focus on, recognizing that many people need supplies, but we want to keep a heavy focus on what our child care providers needed. So that survey is still open for them. We see them coming in. As Sean mentioned, AmeriCorps are looking at those and monitoring that, and will be reaching out if needed. But again, you can also go through that form route, which, and Sean's right, it gets kind of confusing with the survey versus emergency management language of forms and stuff. But in that new document, you will see a form option, and then that will additionally go to AmeriCorps as well. I think by going through the survey on the Family Conservancy site, there's other data that gets collected that may be important for child care providers to provide us, such as what county you're with. Whereas the other form is more of an actual request. So there's two different ways to look at that, but I think the survey is good for our purposes as collecting data as we move along the way. So it's up to your guys' discretion, but recognizing that information as we move forward in the survey may be helpful at getting funding and things such as that nature. So whichever way you'd prefer. But that is on the Family Conservancy website. And if you go to preparemetrokc.org, you can find a bunch of other information for children and youth and child care providers, as well as a link to the Family Conservancy website where you can see that survey come up. So if that's helpful.
So I have heard some input from other community partners and different ideas on locations, but providers, I do throw it out to you. If you do have great ideas, please reach out to me for locations that may work. And I think all of our community partners are dedicated to making this as easy as it can be given the situation, and we'll work to make that happen. But please do let us hear your thoughts if you have any.